Well, health experts expect the fourth wave of COVID-19 infections to hit sometime in November. And so the South African Medical Association is calling for booster Johnson & Johnson shots for healthcare workers if government goes ahead with that plan. Let's speak to the association's Vice-Chairperson, Dr. Mvuyisi Mzukwa. Doctor, thanks for your time. So, of course, you're saying if government does agree to go ahead with booster shots for Johnson & Johnson, the right thing to do would get it to healthcare workers, especially ahead of the fourth wave. Doctor, I think you're muted. Unmute for us.
Okay. Sorry about that. Thanks for having us in your program, Shahan. I agree with you. We are heading towards the fourth wave. And as the South African Medical Association, we believe that healthcare workers are the backbone of the healthcare system. And therefore, we need to protect them, come the fourth wave. We've noted that we've got reports from our members that some of them had breakthrough infections in the third wave. You must remember that they got a vaccine earlier in the year, at around February and March. And as we all know now, that vaccination immune system tends to wane down as time goes on. So you will record that also. It's not for the first time that we're talking about a booster. In childhood, you get as many boosters as you can in that schedule, but also hepatitis as well. After 5 years or so, you need to get a shot. So it's not a new phenomenon at all. But on top of that, you know that there's lots of people who are unvaccinated. So you would expect in the fourth wave, depending on the variant that we have at that time, to have a burden on the healthcare system. So we need to prepare the healthcare workers, to get ready for the fourth wave. When it comes, they must be ready and, to be there in the healthcare system to assist, with the burden of the disease.
Yeah, some would argue it's premature, though, given that we still have a long way to go to actually getting one shot in people's arms in South Africa. We are struggling with this vaccination drive.
Well, you will notice, Shahan, that most of those vaccination sites at the moment are empty. So there are chances that some of these vaccinations are going to expire in any way. So we need to give out those vaccines as soon as we can. Otherwise, it becomes a wasteful expenditure to the fiscus. So I would recommend that if it is possible, government should really consider giving it to healthcare workers.
Yeah, absolutely. Makes sense, right? So let's talk about the preparation for the fourth wave. You're being very proactive in terms of what you say should happen. We know that we haven't been proactive previously. The third wave hit us like we were unprepared on another level. So do you reckon that the booster shots are going to help to a point where we'll see more lives being saved because we know that healthcare workers are at high risk?
Yes, Shahan, we've lost so many of our healthcare workers, in the previous waves. So I think this time around, we must make sure that we have enough healthcare workers. And you know that they are at the front line. So they are at risk of conducting COVID-19. So it's very important that we make sure that our healthcare workers are really protected. Because, they must always be around when any wave comes in. So making sure that we have got enough capacity to handle this fourth wave, we cannot achieve that unless we give it that shot to healthcare workers, making sure that they are protected.
Yeah. All right. Thank you so much for your time. We appreciate it. SAMA's Vice-Chairperson, Dr. Mvuyisi Mzukwa.